Uh, all right. So, what happened?
Okay. Let me get my mind straight. Who am I? I'm a soccer player.
All right.
This happened in the game yesterday.
Okay.
Um, so I went to, I was on a fast break and I went to kick the ball, and another girl like hit me from behind, kind of like from the side, from behind. And I fell, and my knee hurts now.
Okay. So do you remember well, yeah. Okay. So you said you got hit from behind, but on the side.
Kind of, yeah.
Uh, which leg is it on, may I ask?
My left leg.
Your left leg. Did your knee go in?
Um, Not that I really felt. Um, yeah,
Do you remember?
not that I really noticed.
Okay. Oh, that's my dog. Sorry. um. Did you hear any pops or anything?
Mm-mm.
No
Nope.
pops. Okay. Have you ever hurt your knee before?
Not this knee. I hurt the other knee. I tore my ACL about a year ago on my other knee.
Did it feel the same, like this pain? Did it feel the same as you tearing your ACL, or is it a different pain?
Um, the like level of pain is the same, but it doesn't feel like it doesn't feel the same. Like when I tore my ACL, it felt really loose.
Okay.
But this one does not feel loose. It just hurts a lot.
It hurts a lot. Is the pain in one area, or is it like, does it radiate down anywhere in your
Um,
knee?
it doesn't radiate anywhere. It hurts. The whole knee hurts, but it hurts a lot more kind of on the inside on the front.
Inside on the front. Okay. Are you able to walk? Or
I can walk, but very slowly and with a really big limp.
okay, really slowly.
It hurts a lot to walk, but I can do it if I have to.
Okay. uh, are you able to walk upstairs, or is that too bad that it hurts?
No, it hurts too much to walk up and down stairs.
Okay. Is the pain deep, or is it on like the surface level? Like, can you feel it with your hands, or is it like too deep in there?
Um, it when I get to like that little indentation on like the front of my knee, like the inside front of my knee, if I push right there, it hurts a lot. Like it kind of spikes when I push
Ah,
right there. Um, but other than that, it's just all. I mean, the pain is all over it when I touch it. So
could I see where, or can I see your knee where it hurts?
yeah, sure. Okay. Okay. Can you see that okay?
Yep. Uh,
Wait. Let me scoot a little bit closer. Okay. So it hurts the most right there.
okay. Just just in that spot.
Yeah, kind of where it indents. And the whole thing is swollen. It's not
Okay.
really. It's yes, it is swollen.
The whole thing is swollen. Okay. Is it like squishy at all? Is it warm? To the touch?
Yes, it's warm, but there's no bruising.
No bruising.
Mm-mm. No
Okay.
visible bruising.
Okay. Um, could you extend your leg, like try and bring your foot up as far as you can?
I can do it. It hurts a lot when I get it straight.
Okay. Does your knee lock at all? Or has it locked?
It hasn't, no, but I haven't really been moving around on it.
Okay. Could you do the same thing with the other leg, please?
Yeah. So
Okay.
that one doesn't hurt at all.
And could you try to turn your foot in on your hurt side?
Like with it bent or with it straight?
With it bent. Yeah.
Okay, so foot in, foot out. It hurts a little bit more when I rotate it in.
When you rotate it in? Okay. And sitting like that, does it irritate it at all?
Not really.
Okay.
Not when I'm just sitting. This is probably where it feels the best, is just sitting with no pressure on it.
Okay. And so and you said that there's no locking, right?
Not that I've noticed, but it's only, I haven't really moved around on it.
Okay. Could you stand up for me, please? And could you try to perform a squat?
Try to do a squat?
Yeah.
Okay. Am I right? I can't really see my computer. Can you see me?
Yep.
Okay. All right. It's almost just as hard for me to try to fake these things than if it was really good. Okay.
That's okay.
Okay. I can get to about here before it hurts too much to go any farther.
Okay. Was it just pain or was there locking as well?
Just pain. It's just really painful.
All right. So I'm gonna have you. All right. So could you stand on one foot and try and? Whoa! I can't even do it.
Am I standing on my hurt leg or my not hurt leg?
Your hurt leg.
The hurt leg? Okay. See if I can even do this. Like you said, healthy. Okay. It hurts just to stand on that one leg.
Okay.
Like it hurts too much. I can't twist because it hurts too much.
Huh. All right. Okay, so it hurts. So you got pushed onto the ground?
Yes. So I got kind of hit from like this direction while I was kicking.
From the lateral, from your side, you got hit.
Yeah, it was kind of from like diagonal, kind of from the side, kind of from the back, at an angle.
Huh. All right. Okay, let me think for a second. Could you palpate or feel on the inside of your knee, and could you tell me if that hurts at all, like on the how do I say this in non-anatomical terms? And the medial side, is that anatomical?
On the inside.
On the inside of your knee. Could you try and palpate for me? Is that hurt?
I don't even catch it because I know the words you're talking about.
And could you show me where it hurts?
Oh, yes, I can. So, when I poke around here, it does hurt, like right here.
Okay.
Yeah, right there, and then kind of up in here, like this this area, and then up in the front a little bit. It hurts when I poke it there.
Okay. So judging on your mechanism and from the information that you've told me, I'm thinking it's a possible medial meniscus tear,
Okay.
or, well, yeah, medial meniscus. So what we're gonna do for that is we're gonna splint for now, and then we'll refer you. Then we'll see what the doctor says from there, and then if it's not that, then.
So let's say I'm quarantined for the next week, so I can't go to the doctor. What would you have me do for it until I get into the doctor?
I would have you ice for sure.
Okay.
Rest it, and I would want to be cautious for a while, and then. Julio, stop! He wants to come into my room. I guess I could have you take some NSAIDs just to help with the pain.
Okay.
And yeah, I don't.
Is there anything I can do like that would make it get better faster?
That'd make.
Or should I just stay off of it? Or are there like exercises or stretches or something that I can do?
Oh.
It's not a trick question.
Okay. Okay. Well, I'd say for the first few days, just to help with the swelling, to keep it resting, and then maybe we could try and do some more things to help it get better. But just for now, we'll be cautious with it. Don't want to make it worse.
Okay.
Before you see the doctor.
Cool. Good job. You're on the right track with the medial meniscus. Don't be afraid to like make a patient get up and move more, even on a video. I was trying a little bit to make it seem like it was too much pain, too much swelling for me to move much. But also don't get so focused on like, yes, you were right. I was thinking medial meniscus, but you can also, like if you would have gone a little bit farther and maybe have me try to move it side to side. Like you asked the question if you felt like the knee gave in to the middle, like if you felt the knee give in, which no, I didn't. But if you would have asked a few more questions, like I was thinking a little bit of that MCL as well, just a little bit of a strain on that just because of the direction I got hit. And really you're going to do the same thing, like treatment wise, especially if you can't get them in to see a doctor or something like that. You're going to do the same thing, ice, rest, again, depending on how it's going on. Like your timeline might look different, or you might get them started on even just range of motion. Like, hey, I sit for 20 minutes and then just work on some range of motion, just straight flexing, extending of that knee so that it doesn't stiff, stuff like that. But sometimes the knee is hard because there's just so much that can go wrong in there. But you don't necessarily have to narrow it down to one very specific diagnosis. You get it narrowed down enough to be like, okay, I'm treating one of these medial structures in here, whether it's the meniscus or the MCL or even one of those muscles that, crisscrosses kind of back behind there. And then you can do kind of a generalized treatment is usually what I do to start with. And then as, especially because it's an acute injury, it just happened, 24 hours ago. Once you get that swelling down, then you can go back and reevaluate and say, okay, now that the swelling is gone, your pain's down a little bit. Now let's look a little bit closer and see if we can narrow it down even more. So yeah, don't be afraid to ask more questions than you think, or it's not always going to look the same. Like I actually this year had what me and the doctor thought was a medial meniscus injury on one of my athletes. And but that was without the MRI. But like everything was testing, all the meniscus tests were testing positive, everything. But we thought it was a minor tear. So a basketball player also didn't want to sit out. She was able to pass the functional tests even with the pain. So we let her continue to play. Well, we finally got to the point where we're like, okay, this is enough. We sent her in to get the MRI, and it was actually like, I don't know if you call it like a compression fracture.
Okay,
so
yeah.
the meniscus was still intact, but the two bones had hit, like her femur and her tibia had hit together so hard that normally when those hit like that and twist, that's what tears the meniscus. Her meniscus didn't tear, it just hit so hard that there were like spidering fractures on both of the plateaus of her fibia, or of the femur and the tibia, which was super strange. So basically she was playing on a fracture, 2 fractures the entire basketball season, which was kind of amazing. But it's one of those that's like, either way, we're going to treat it the same. Now it got to the point where, okay, we've been dealing with this for 3 months and nothing is getting better. Basically it's because she had a fracture and was still playing basketball on it. So you just got to kind of, and it's your best guess because we don't have x-ray vision. We can't see what's going on inside.
Yeah. So in this case, what else would you have me do for like the medial meniscus? Like what could I have done, like manual muscle test wise, and like not necessarily special tests, but like more so that I could, narrow it down to that.
Narrow it down.
Or MCO.
MCO. The only thing I would have done, just depending on your injury, but like even just having me sit on the ground and like say, hey, can you put the camera to the side, have me sit on the ground and even just push, like straighten out my leg and just kind of push it medially or push it laterally, almost like your varus and your valgus test.
Yeah.
Doing both of those, because like if you would have had me do the valgus test, I would have said like it hurts on the medial side when I do that. It doesn't necessarily open up, but it hurts on the medial side. And then with that varus test, I'm like, oh, it hurts right where I'm pushing, right on that medial side.
Okay.
So you can kind of have them anything that they can reach, you can do on their own, or even just like that leg extension, even having me turn to the side so you can see it a little bit better, or having me do it slower. Be like, okay, how slow can you do it? Or once you get it to the top, how, like, can you hold it there? Or even kind of like a straight leg raise. Once you get it there, can you turn like your toe out, kind of do that medial? Like I would not have been able to do that in this scenario.
Okay.
Extending, yeah, it's that quad, but the minute I turn that leg out, that puts a lot of stress on that MCL. And that would have been like too painful to do it in this scenario. But I mean, you did a good job. You got it narrowed down pretty well. I mean, it just depends on how much you want to confirm, like, I'm going to do all these different things to put stress on that medial side of the leg to see what comes and what doesn't. At that point, you already know that it's the medial side of the leg. So you're gonna pretty much treat it in this scenario, especially if they can't go to the doctor right away. You're gonna treat it the same no matter what structure it is. Hopefully, keep them non-weight bearing for a while until that swelling goes down. Ice, Tylenol, something like that, one of the NSAIDs, and hopefully, just once that swelling goes down, then you could even say, okay, like especially in this scenario, okay, we'll video chat again once your swelling goes down, and then you can do some of those other tests like the varus and the valgus and some different things like that, just to narrow it down. But yeah, especially with a meniscus, until like the scenario I gave you was probably a fairly big tear. But if it would have been a smaller tear, you could have worked them back up to the point where like, okay, swelling wasn't really much swelling, or swelling is gone. Now let's try, okay, is walking, like what's painful, what's not? Do you want to try some jogging? If you start jogging and then it swells up again real big, or just basically it's a gradual return to play. If you try to treat it yourself as an athletic trainer without a doctor's input. Now, I wouldn't necessarily recommend that. Especially if you think it's any sort of meniscus. But sometimes, like, so I work in a secondary school, and I actually work at a fairly poor school. And so
Okay.
parents a lot of times do not want to send their kids to the doctor, especially like they hear the word orthopedic doctor and all they see are dollar signs. And they're like, oh, well, that's going to cost me a bunch of money, or like, we don't have insurance. So a lot of times you just have to treat them as best you can, you know, without
Oh
getting images
gosh.
or without, now we have a team physician. I mean, he doesn't come to the school, but like he's the physician, my supervising physician. And so he's really great about like, I'll consult him like, hey, I got this athlete, you know, parents can't afford to come see you. What can we do? How can we work together? And so like, I can bounce ideas and stuff off of him. But yeah, sometimes like it basically, I just have to do it myself. Now there are sometimes too, when I'm like, I can't make that call. I have to say, no, you have to go see a physician. I don't care what kind of physician it is, because your family doctor is going to refer you on anyways. Like, I need a doctor's signature on this before I'll let you play again. So you'll just, depending on what setting you end up working in, you'll figure it out real fast on what you need to do and what you can and can't do. And you'll learn your athletes too, like which ones are making it a bigger deal than it really needs to be.
That's interesting. I didn't. So is that like scary at all? Like to, well, I guess I can stop recording.
Like